All right, we are ready to get started, and we're going to hustle through here today. We're trying to be very conscientious to gatherings of more than 10, 15, or 20 people, which we have today. So we're going to move through this council meeting. But the first up, we have an update on the City of Waterloo's response to the COVID-19, and that is the coronavirus. So we have a couple of people that will be speaking to us, but we also asked that Dr. Nafissa Cisse-Egbuonye will make a couple comments about what's taking place on the county level and maybe how we're interacting and multi-city responses too. So, Dr. Cisse-Egbuonye, would you please join us for a few comments? I didn't send out anything, but just if you can give us an update on what's happening.
Well, good afternoon, Board. Just a quick update for Iowa. We're now
Could you announce yourself and then give your address for the record for all the people out here and for our record keeping?
Nafissa Cisse-Egbuonye, Public Health Director for Blackhawk County. Okay. So just a quick update for Iowa. We are currently at 23 cases. Governor Reynolds just announced an additional case, and that is a second case in Dallas County. So the counties with cases are Carroll, Dallas, Johnson, and Pottawatomie. There have been no cases at this moment in Blackhawk County. And so one of the things that we've recognized at the health department is that there are some national guidelines in terms of mass gatherings that are released. But as of right now, with the health department, because of where we're at in terms of Iowa and our cases, it's still larger than 250 people. But I know that information was just recently released for just mass gatherings of 20 and less. But for Iowa, the Iowa Department of Public Health has not given us this low number. So I do want to provide that clarification. So right now, the Iowa Department of Public Health recommends to cancel gatherings larger than 250 people and to reduce activities, especially for at-risk groups. We're also recommending that travelers returning from COVID-19 affected areas should self-isolate and remain home for 14 days to monitor for symptoms such as fever, cough, and difficulty breathing. And the CDC has the travel advisory of the locations. So these are geographic areas where sustained community transmission has been identified. So I know with people returning for travels, they might have questions. I would tell their direct reports to look at the CDC travel advisory. And those advisories provide the most current information on travel risks, and people should review them when planning to travel internationally, especially. There's an expansion of testing, so healthcare providers can test at any moment. They will most likely screen patients who are calling or who are concerned before providing the test, but the test is now readily available, so which is a good thing. But there's an assumption also out there that you should just be tested for COVID-19, and that's not the case. The providers will screen for to see if the individual meets the criteria for that. We are recommending that mildly ill patients or employees to stay at home when they're feeling sick. So I do want the city to encourage that for people just to stay at home when they're, even if they don't have a doctor's note, if they're not feeling good, to stay at home. So the Blackhawk County Health Department, we've been working with the Iowa Department of Public Health and our local partners to continue to implement screening, monitoring, and mitigation guidelines. We push down communications to our local partners and private partners in terms of just what are some of the different strategies organizations have to implement to reduce the community spread. And one of the things that we're really emphasizing is that employers and the general public implements the 3 C's that we call, which are prevention. So staying at home, containment when they're not feeling good, covering your mouth or your sneeze with a tissue, and I'm just blanking out. Yeah, covering, staying at home, and also if you're not feeling good, to contact your provider. And also washing your hands. That's one of the things that are very critical for this spread to reduce. So constant washing your hands. The kids should learn to at least take 20 seconds, and we're providing those communications also to the schools and childcare facilities. Other than that, we will have, the EOC will open tomorrow at noon, and so we are looking at also ways to continue to work with our partners in terms of standardizing communication. People are getting communication from different outlets, and we want to make sure that the information that they're receiving is factual and also relevant to Iowa, because sometimes it's also national news that people are receiving, and that doesn't pertain to us at the moment. So any questions?
Mr. Foyce.
Just a couple. So you said that we have tests readily available. Are those at doctors' offices, or are they
Yes.
at hospitals? And roughly how many do we have in Blackhawk County to be able to test?
So the tests are it's the same test for the flu, so it's not there. It's readily available. So it's the nasopharyngeal test, and now originally it was the state hygienic lab that can only do the test, but now reference labs, so any laboratory can really do the test. So it's available. I think what maybe needs to be clear is that the doctors will still screen people to ensure that they meet the criteria. So just an example of that, people can come to the physician and make assumptions of what they have, but the physician will deduce what kind of testing needs to occur.
So what if somebody doesn't have a primary care physician? Are we urgent care then?
Yes, so
Yeah.
that's one of the things. It's urgent care, but the hospitals are being inundated. So I think they're also at this moment trying to implement some of the systems they need to be able to really control for that amount of people calling. But when you don't have a primary care provider, it's urgent care that you should.
Thank you.
Yeah. Mm-hmm.
Mr. Mayor. Mr. Morrissey.
Yes, the question I had, what about those people that are listening, or what about the people that don't have insurance? How is this paid for? The testing?
So at the moment, I believe the testing is free, but that has to go through the state hygienic lab. So with the providers where people that are being tested and the tests are sending out other places, this has to do with the insurance carriers. So we still need more information on how people are going to be billed.
They don't have insurance.
If they don't have insurance, that's it's the same protocol that they would need to work something out. I think also the hospitals, they have a financial assistant program, but it usually we want, if they don't have insurance, the test is free when it goes through the state hygienic lab. So I don't know what the systems the hospitals have if they don't go through the state hygienic lab. So that's something that we would need to get clarification on. Yeah.
Mr. Mayor, Dr. Egbuonye.
Yes.
We're rapidly approaching several large events tomorrow, St. Patrick's Day and other things like that. I know that Iowa has not moved to gatherings below 250, but we're hearing national requirements or national guidelines now that we should be moving to to 20 or fewer. Is that something that we're looking at? Is that something that we should just be moving towards anyway, even if the Iowa Department of Public Health hasn't issued those guidelines yet?
That's a great question. I think that one of the things to keep in mind, these recommendations are also provided so that organizations can deduce the financial impact, have time to also plan appropriately if there's capacity for the social distancing. And so if those events can be postponed, they should be postponed, right? Because we don't want, what we're trying to avoid is the cluster of people, and that's why we're calling it mass gatherings. And that's the best way to avoid the spread, so.
And then just a second question. Do you know offhand how many ICU rooms or respirators are currently available across Black Hawk County right now?
No, not at this moment.
All right, Mr.
Sorry.
Foyce.
So just a quick question, Doctor. When you're tested, how long, like at the doctor's office or the hospital, what's the turnaround time on that for you to be diagnosed?
It all depends, but I do know that the laboratory systems are working really fast on that. So it really depends on when the carrier has taken those specimens and just the transportation and the results. But I would say that it shouldn't take no more than 48 to 72 hours. But it's just one of those things. It just depends.
And then if it goes to the state hygienic lab, how long will that take? Because I assume that's in Des Moines, correct?
Yes, so that's pretty fast. It's just and the same would be within 48 hours.
Okay. Thank you.
Yep. And so just so you know, for the Black Hawk County Health Department at this time, we are not being notified of the tests that are going on. We will just only be notified of positive cases. And so I know that there's a lot of questions. It's now testing is just readily available. Just kind of take it like the flu. But COVID-19 is a reportable disease, so we will be notified of the positive cases.
Mr. Bozen.
Yeah, doctor, I just had a quick question, and you say it's the same test, it's just a nasopharyngeal swab. So when the federal government says that there are no tests available, but yet it's the same swab as we do for the flu, we've had these available. It's just
Yeah.
the labs to do it. Is that what it was?
Yeah, the labs. So originally there wasn't clearance on the labs to do the testing. So for example, with Iowa, it was just the state hygienic lab that was doing it, but now any reference lab can do it.
Okay, so it wasn't some testing device they needed.
No, not the test
It was
kits.
it's just a swab.
Yeah.
Okay, thank you.
And I think part of this is we're receiving a lot of information in real time.
Yep.
So 24 hours, this happened, and another 24 hours, this happened, and then before you know it, within a week, life has changed so much as we know it. But I think one of the things that help, I want to thank you for being there every time we call, and then also coming on the show to give an update so that we can clip that and put that out for people. Because in situations like this, the right information is the best information. And, understanding that we have the Iowa Public Health Department, then we have the CDC.
Yeah.
So the CDC may be putting together broad range types of activities that may be inclusive of states that are more greatly impacted.
Yes.
And then we have the Iowa Public Health, in which gives directions to your department.
Yes.
Having that understanding, because someone may ask, why 250, why 50?
Right.
And may not have both of those, that understanding. But we want to thank you for being there and giving us clarity on that as well. And we just had a meeting earlier today to talk about the emergency operations center. And that's opening up tomorrow at noon, and that will provide greater conversation for ourselves, Cedar Falls, the governments, and then like our healthcare facilities as well. So we're thankful for that also. So we'll probably have just like 2 or 3 more minutes left so we can have our staff make some presentations. But if you please stick around for us for about 5 more minutes, that'll be incredible.
Mayor, I have a question for the doctor, please.
Why don't we do this, Alex? After we get done, can you take his question after we get done? So, because I want to make sure I get folks in here talking about facilities. So, Paul, we made some changes with regards to your facilities. You want to give us an update?
Sure. Paul Hudding, Leisure Services Director. This has been rapidly changing, but as it stands right now, we have not closed any facilities. The Cedar Valley Sportsplex and Young Arena are both operating under different rules or different conditions than we were very recently. Both buildings are open, but all activities are canceled for both buildings. What that means is you can still, if you're a member, you can still come to the Sportsplex, you can work out individually, you can walk, you can utilize the cardio equipment, you can do individual exercise activities. At Young Arena, you can walk, we're open for that. The ice is still in, but we've suspended all programming at this time, and the Blackhawks operation is suspended now too. That doesn't necessarily mean canceled, but it's on hold.
And we kind of limited things so we don't create that cluster effect.
Correct.
So we can be consistent with our experts, but very limited services. So thank you, Paul. Nick, you want to give us a quick update on happenings, because those may even change soon.
Nick Rossman, Library Director. We were open today, and we've canceled all of our programs, events, meetings, and stuff like that this week to start. And then as we go on, I'm sure they'll change. But we've had people in the building, kind of normal traffic, but probably no more than 70, 80 people in the building at one time.
Yep, so we're monitoring happenings there as well. And with our Center for Arts, I think our plays, big groups, smaller groups are pretty much not happening right now and mostly postponed with very limited usage. And the youth pavilion is not open as well. And so we're monitoring situations that are happening. We're asking people with City Hall, like the groups that we have in here tonight, I don't know how that's going to shift in a little while, because we want people that have questions to please contact the individual departments, but also make sure you take the necessary precautions at your own houses. Major Leibold, if you wouldn't mind, could you give an update to people on the way that they can contact the police?
Major Leibold, Waterloo Police Department. We actually offer online reporting, so you can go to our website and report things on there that are non-emergency in nature, whether it's a theft of something off your property or something like that. You can essentially fill the report out yourself without ever having to leave your home or having an officer come to your door. We also implemented some stuff where we might ask you to come outside or have you call in instead, just to limit the contact the officers have with the general public, just to help slow down the spread.
Thank you. And I would like Chris or Kelly, one of you want to talk about a question that was posed to our dear council member about how council can communicate to one another during council meetings in the future. So do we have a plan for that? If we want to hold a council meeting or do something?
Chris Youngblood, Director of IT. So we kind of started it today, trying to get this rolled out, but we do have a GoToMeeting subscription that we're able to use to hold online meetings so that we can provide you guys with a call-in number. We're working on getting it tied into the rest of our technology so that it looks appealing when it's aired to on television. Meetings are also aired for the public on our YouTube channel. So if you go to YouTube and you look up Waterloo Community TV, you can view the council meetings there. So that's more on the public side. But for council members that wish to join from home, we'll be providing call-in numbers and a web link to be able to join that way.
So we will be able to have access. Kelly, you were going to say something?
Yeah, and then as far as the public participation goes for when we have quite a few council members calling in. If the public isn't wanting to come down to City Hall to attend the council meetings in person, I will have my email address open and available during the city council meeting. So if you want to send a comment, you're welcome to. Also, if you have questions or comments about something that's on the agenda, you're more than welcome to contact my office. Our number is 291-4323. You can submit questions for the agenda ahead of time, and we'll get those distributed around to council members as well.
Right. And so we've been communicating with Waterloo to Cedar Falls and outreach to Evansdale. We've been in communication with our county partners, with other mayors and municipalities across the state. We've also been in communication with healthcare providers and our emergency management systems that we have here locally in the sheriff's office. So we've been trying to do our due diligence to stay on top of this changing situation as much as possible. So we thank you for your patience, but we are at the point where we're kind of discouraging people. If you can't take care of business without being here, then we ask that you not come back and forth to City Hall, but do it as least amount as you can at this particular point. We're also working, there's several cities around the state that has put in emergency proclamations, and we've done it before with regards to floods or natural disasters, but this is a public health situation potentially in our local community. So we will be bringing forth information to council, which gives us the ability as mayor to be able to make some decisions, whether it's dispatching some type of service somewhere, if we need to buy a particular, let's just say, mask or whatever it is, give some flexibility for us to be able to make some of those decisions, given that conditions are changing every 24 hours. As well, so that information will hopefully be coming to you this week. So, anything else?
Mr. Mayor?
Yes, sir.
Kelly, I just wanted to ask you, you'd said that if people wanted to call in with questions during the meeting, is that what you said?
We don't have the capability for the public to call in for the meeting, but they can send email to myself, or they can contact my department prior to the start of the meeting and submit questions or comments that they may have about an agenda item.
Okay, so there would be, a person would be identifying him or herself, and the same kind of procedure we go through here in person. Yep. Okay.
Yeah, and then just to remind the public, these council agendas are posted prior, so you'll be able to see what the agendas are or learn about them in some of Tim's great reporting about what's going on. But get those questions to us, or get information to council to get your questions answered as well. So any other questions for the cause? Yes, sir.
I don't have a question, just a kind of a statement. I know that the Iowa Utilities Board, I think, extended out their time frame for payment of services. I know there's not a lot that, I think, I'm just thinking of the amount of rental properties that we have and the potential for if some of our restaurants and other places shut down, that we're going to have people that aren't going to be able to afford the places. So I guess I'm kind of calling on our landlords to be a little gracious in what they're doing for their renters during this time. I think we're all kind of in a unique situation, and if somebody's out of a job and doing some of this stuff, we need to make sure that we're kind of working as a community during this time.
Incredible point. And our waterworks right now is taking some of those same very steps as well. But I think with this situation, this is one where everyone can play a role, whether you're a landlord, whether you are city staff, whether you're a person in the community. Everybody can play a role, and that is to help mitigate some of the risks that we can see with this particular pandemic. So we just ask everybody to use the wisdom that's given from our Black Hawk County Health Department and other people that are experts in this area, and follow direction and take this situation very serious. So everybody can play a role in that and help.